children with disabilities go through all sorts of abuse from their families, their siblings, the community.
They experience a lack of dignity, and that they're seen as cursed or even not even human in some cultures. They experience pain because of their disability, both physical and emotional.
And these children who are neglected, they never get education opportunity. They are a burden for their family. Many end up begging, and many of them are really a burden for the society.
About 200,000 children are born worldwide every year with Clubfoot. Clubfoot is a deformity that severely twists the foot downward and inward, making walking difficult or impossible. It's a correctable condition, the treatment is inexpensive, and Cure International is working to let everyone know that we can help.
Our goal of Cure Clubfoot is to reach all children. Any children that is born with this condition, we can heal.
In the past, before the Cure Clubfoot program, many of these kids would present later on in life, 10, 11, 12, with a severe deformity which needed a considerable extent of surgery to correct it. We are trying to turn off the tap that's producing these really disabled elder children by catching them while they're young, while the foot's relatively malleable and correctable.
Through manipulations of the foot, the Cure Clubfoot program uses a multi-stage treatment known as the Ponseti method.
The first stage is the casting. The casting lasts from 4 to 6 weeks, and during this period of time, they're gonna receive casting every week.
Clubfoot treatment with Ponseti method is a long-term treatment. Even though the foot is corrected in 4 to 6 weeks of casting, the foot has to be maintained, where the brace has to be worn for 4 to 5 years to make sure that there is no relapse. And counselors make sure that these parents understand the importance of this treatment.
With more than 350 clinics around the world, the Cure Clubfoot program is treating clubfoot through partnerships with national hospitals, governments, and other organizations in order to build a sustainable future.
The Clubfoot program involves training local providers of care for clubfoot, and in countries where there are a lot of available doctors, such as India, we use the doctors that are there. And in the resource-poor countries such as Malawi, Kenya, Zambia, we use clinical officers and paramedical individuals.
When children and their mothers in particular come to our hospitals or clinics, we realize that the physical disability might actually be the easiest disability to deal with. There is a more complicated disability, which is spiritual, emotional, psychological.
Cure doesn't come into a country just to meet its needs. We want to have a nationwide impact and a long-term impact through generations, where we actually are training physicians, nurses, healthcare workers. But it's also on the other side, the spiritual side. We're training people on how to counsel parents and families who have a child with a disability.
In Niger, all our counselors, they have good view of disability, and also they help in tracking patients because they live in the community and they have to pay visit to patients in their families to show them the real love of Jesus.
Since 2006, Cure Clubfoot has grown from a small program in Malawi and Kenya to a global program treating thousands of children every year.
The work of Cure in getting the Cure Clubfoot program together and uniting other organizations and setting up national programs has been explosive in the number of kids that have been able to be treated.
Before, in the past, we used to see people on the streets with this condition, but now the situation in Dominican Republic, we almost don't see cases like that, like we used to see before.
And here is a model in India that has emerged in the last 5 years, which is working so well, which has turned to be a public health model. And now the government is actually thinking of taking this Clubfoot Cure model and see how they can help other children with disabilities.
My dream is that once Cure has been in the country, 10, 20, 30 years, that people across the nation start to think of the disabled completely different than they did before Cure came.
When you have a job where you are restoring people, is something that gives you happiness because you see the progress, you see that you are changing lives.
We meet so many families who approach us with utter hopelessness. And when our counselors talk to them, tell them that the children are going to be perfectly all right, when we see the joy and happiness in their life, also the changes that we see in the life of these children, it's very encouraging.